good morning. So I'm gonna perform an isotracheal suctioning. So first and foremost, always make sure to check the patient's chart, obtain any relevant information. Before going inside the room, make sure we wash or sanitize our hands. And then once inside, we always do our introduction to the patient, let them aware what we're going to do, and then explain to them what's the purpose of this procedure. So once you're done of those, make sure we check the ID band for confirmatory purposes to the patient, and then we can proceed in doing our set of vital signs or pre-assessment. Make sure we observe the SpO2 and heart rate, and always include listening to their breath sounds, especially if we hear any abnormalities in their lungs. So once you're done, make sure we rewash our hands or re-sanitize, and then make sure we have to wear a clean gloves, and also wear appropriate PPE such as a gown or face shield, so that we can prevent any splashing fluids from being exposed from the patient. And then we have here the non-rebreather mask. Put it up to the patient first. Allow the non-rebreather mask to inflate the bag, and then let the patient hyperoxygenate for doing the procedure. And then try to check also the regulator. With the regulator, make sure inspect the bottle if there are any cracks or any misconnections or any leaks with the tubing. Also observe if it is clean, no obstruction on it or not even kink. Try to spread the tubing. Make sure that the tip would not hit the floor, and then when to know if what's appropriate pressure, we can obstruct it, and then can observe if how much the pressure is. So with the adults, make sure it's not more than negative 150. It must be negative 120 to negative 150. If it does exceed, we can just adjust it. So everything is done. We have here the supplies ready. Sure, we have the sterile gloves fully opened, and then we have the lubricating jelly. Make sure the lubricating jelly, we should put it either in the cover, or we can also have a clean gauze present. And then pour adequate amount of sterile water so that the catheter will be sterilized. And then in here we have an nasopharyngeal airway. So make sure every time we do the procedure, we have different sizes with us at all times. And then when knowing the appropriate size, we can either measure it from the nose to tip the nose until the earlobes, or trying to view with the bevel if it's too small, the hole, or too big for the patient. So every time we insert this one, make sure we lubricate it, the lubricating jelly, and then try to inspect for any obstruction inside the patient's nose or any deviated septum. So when inserting this one, make sure we insert it gently, and then if we sense any obstruction, we have to insert it in a twisting manner until such time we reach the appropriate place where we're gonna put the nasal airway, and then set it there, and then allow the patient to hyperoxygenate, and then remove the clean gloves, rewash or sanitize our hands, and then we should wear the sterile gloves. So when doing the nasotracheal suctioning, make sure we have our dominant hand and our clean hand. So for me, my dominant is my right, so that is where I'm gonna do my suctioning part, and then my left hand is where I'm gonna grab anything for the suctioning part. So using my left hand and my sterile hand, which is the right, so with the right hand is have to insert it until we hear a hissing sound, then try to suck adequate amount of water, sterile water, or maybe there's also a scenario where the physician would obtain a specimen, or we can put a specimen trap or mucus trap in between of these two connections. So once you're done, try to lubricate it, and then remove the oxygen, insert it gently, to the patient's nose. We should not do a circular motion when inserting it because it might cause any trauma to the patient or any bleeding. And then when we first observe any obstruction, let the patient cough until we notice to let the vocal cords open. And then another thing to note is when